Hello again. It's nice to see so many of the same faces back after our break. I hope everyone's feeling recharged. The afternoon will continue to deliver some exciting content. All the content from today will be available to view on demand within 24 to 48 hours, so don't worry if you've missed something earlier. So let's explore a topic that, whilst is so important in the NHS, is a topic that has such significance in the wider world too. Patients, visitors, workers and suppliers to the NHS account for roughly 3.5% of all road travel in England, accounting for nearly 14% of the sector's total emissions. This panel looks to explore the growth of electric vehicles and charging infrastructure, organisations promoting healthy, active modes of transportation like cycling and walking, and how providers and healthcare organisations can work together to help achieve net zero targets. So joining us as we explore the future of our transport and travel across the NHS are my expert panellists. We have with us Janet Smith, Head of Sustainability at the Royal Wolverhampton NHS Trust, Kirsty Wavish, Green Plan Programme Manager, University Hospitals Plymouth NHS Trust, Oliver Slaughter, Head of Environmental Services, Sussex Community NHS Foundation Trust, and Sue Wales, Head of Strategic Transformation, including Sustainability Lead, Ashford and St Peter's Hospitals NHS Foundations Trust. So don't forget the Q&A feature, which a minute ago had magically disappeared from my screen, which is on the right side of your screen, and it's built in so that you can ask questions too. So lovely to start off the afternoon with four of you. Good afternoon to everybody. Janet, let's start from you. You're with a halo of bathed in a halo of sunshine behind you, actually. As Head of Sustainability, how key is travel and transport in the Trust journey to achieving net zero carbon by 2040?
It is actually quite a key issue, given that with the Trust, we've just actually finished our carbon footprinting exercise, and the findings is a baseline of from 2020-21 that we actually have 389 tons of carbon as a carbon footprints, and that includes business travel, includes patient transport, and also includes transfers with like when you transfer babies between hospitals. So it's quite a key area, and it is also one of the areas that is actually very, very challenging to address, particularly within patient transport and of course the staff commute side of things.
And that figure, Janet, was that a kind of figure that you were expecting, or was it larger or smaller than you thought?
It is actually largely what we are expecting, but given that the services of the Trust is growing, making more regional, so we are also expecting that will also increase. So it is vital that we actually put in place initiatives already, and also work with our patient groups, our staff groups, to actually put initiatives and other measures that would help us address that. And I think one of them, of course, is the virtual clinics that we have put across. And I think later I would like to actually tell you about what we have achieved in terms of that and what carbon footprint we have reduced.
Hold that thought. I'd like to come back to virtual clinics and also further down the line talk to you about what initiatives you're going to put in place. Now, Sue, are you still with us? I've lost your screen. Can you still hear me, Sue? We've probably lost her, Sue. Well, in that case, we'll jump to you, Ollie. Tell us what you're up to in Sussex, and are you embracing electric vehicles down there?
So it's a good question, Helen. So in Sussex, we've been trying to reduce the emissions associated with our transport for quite a while now. Sort of, I think to be bold to say that we sort of pioneered the use of sort of hybrid and lower emission vehicles sort of beginning in the NHS. So we were quite early starters, but the competition's been fierce, and a lot of trusts have sort of caught up and are doing some really great stuff. But now we're sort of turning to look at the sort of practicalities about what's possible, how quickly can we sort of move our fleet to electric, and what do we need to do sort of in addition to that. We have quite a lot of, because we're a community trust, we have quite a lot of nurses going out to patient homes. So our sort of overall mileage is in the sort of millions of miles per year, and sort of it's thousands of tons of CO2. And we have yet to sort of measure our sort of staff and patient commuting travel as well. So we think that's only going to go up once we start measuring those things. So there's a lot to do in travel in a community trust, that's for sure.
And how are you coping, Ollie, with the electric vehicle charging infrastructure? You know, not only the cost, but the worry that if you install something, you know, have you future-proofed it? Is it going to be quickly out of date? How have you coped with that side?
So it's another good question. So we recently worked with Sussex Partnership, which is a local mental health trust, to set up sort of a plan for their charging infrastructure across their whole sort of patch. They have a similar patch to us. They have quite a lot of different sites and a similar requirement. And really, just the whole we've taken about a year for us to find a supplier, to go through the procurement and make sure we've got someone on board that can help us put in this charging infrastructure. Because you'd be forgiven for thinking, oh, you just put a plug on the wall and then you plug into it and that's it. But it's there's a lot to consider around sort of the maintenance. You need to make sure that the actual charge point can be used and doesn't break down. Otherwise, you lose faith with people very, very quickly. You need to make sure you can get data from those chargers to work out who's charging when and how. You need to check the electrical capacity of a building. So there's a lot that you need to kind of consider when you're putting in the charging infrastructure. So it's really worthwhile doing your research and taking your time. But I think if you take it sort of seriously, and you can convince your organisation to take it seriously, you can begin to sort of look at a larger scale. So it has its sort of benefits and drawbacks.
Absolutely, there's a lot more to it than meets the right eye, isn't there? Sue, you dropped off for a minute there, so since you're back, I'll bring you into the conversation, and then we'll chat to Kirsty. What's your trust focusing on in terms of your green plan as far as transport goes, to try and reduce your footprint for staff and obviously for patient transport as well?
Sure. There's I presume that you've been talking about the technical things and the electrical charging, because that's just one thing. For us, there's a big emphasis on staff behaviour. And also our patients and local citizens' behaviour, because it's one thing about putting charging points or whatever, but we've got some practical local things like what we call BUG, a bicycle users group. So that is trying to encourage staff to cycle to work more, and with improvements in the storage and the security and the access to bicycle stores and things. There's new cycling routes that are being built at the moment by the council that we're kind of in line with. So it's aligning with those on those kind of things. And then there's also things about car sharing on staff commutes. Can we get staff to do more of that? With the increased cost of petrol and diesel, we're hoping that's going to help an awful lot to get more staff to car share on a more regular basis. So it's not just about putting the technical infrastructure in. I'm assuming that's a given and it's an expensive thing to do, but far less expensive is to change our staff and our patients and our public's views as well. Because the virtual appointments, I got the figures out yesterday that we last year did just about 465,000 outpatient appointments. 147,000 of those were done virtually, telephone or video. And we did a study during COVID when we were doing a lot of the video appointments that averaged out at 600 grams of carbon emissions saved on average per appointment that is not done physically on site from the patient side. So again, over a year, we're talking about something like 87.7 tons of carbon saved on that change of behaviour. So
Wow.
big emphasis on our carbon footprint is about behaviour as much as the technology.
Amazing. And Kirsty, I'm sure you'd agree with Sue that, people are of everything that we're trying to achieve. Part of your Trust's 5-year green plan is to encourage more sustainable behaviour. And I'm just wondering what initiatives you've introduced to try and get staff to come to work in a more sustainable manner.
Yeah, sure. So at the beginning of the year, behaviour engagement program, and part of that program includes also trying to encourage people onto the bus, cycle to work or walk. We've just kicked off a travel campaign which is due to last for the next 6 months, and that's really sort of trying to establish what the issues are with people in terms of sustainable, if there are barriers, what we can do to remove them. So, if there's confidence in terms of cycling to work, having sort of cycle training, helping people to find out how they can purchase a bike. We've actually got pull bikes and electric bikes that our staff can hire, and they can hire them for free. So if they even want to try before they buy, then that's an option as well. And they're really, really popular, especially our electric bikes. They're constantly out. So we've been looking at trying to increase those. But we're also going to be looking at having a bit of a maintenance shed on site as well, so people can do sort of basic repairs to their bikes and things like that. So, and then increasing our changing facilities, lockers, etc. So when staff come to work, they find it easy to transition from cyclist over to staff. So yeah, there's lots of things going on. We work quite closely with our local authority as well. They're quite good at throwing out workplace travel grants, so we can make improvements on sites, changing facilities that are being built on site near one of our bike sheds at the moment. But they're also doing an initiative where it's going to be electric vehicle cars that you can hire. They've got these hubs that are going to be all around the city, of which the hospital is going to have one of these hubs. And it just basically links the whole city together and really starts to bring the whole sustainable travel together. So it's all linked. People can move around in bikes, electric cars. So there's lots of initiatives going on. But I mean, we often come back to the same things. It's the distance travelled that causes issues. We're Devon and Cornwall, essentially. So we've got staff coming from all over. And that can be a big barrier in terms of getting people onto sustainable travel. But yeah.
Just briefly, Sarah says, do you have safe parking systems for bikes? The issue of theft being a potential challenge.
Yeah, so we've got secured bike sheds. We've also got open bike sheds and Sheffield stands around the site. Asked to increase the amount of secured bike sheds that we've got on site. So that's something that we're doing and looking at improving across the site.
Janet, we promised we'd talk about virtual clinics. I'm just going to read you what Naomi says. Naomi says, we carry out annual sustainable travel surveys, reviewing mode changes and behaviour initiatives. Interestingly, COVID and home working made an enormous difference, with virtual appointments reaching 78% and emissions only a third previous year. Tell us more about your virtual clinics that you build so well. Your first answer.
Yes, actually, she's right. The COVID pandemic sort of push us to things that we never considered before, and it has become then an opportunity. Like right now, we're doing this online. But with regards to the appointments, the trust actually formed from April to December last year, and this is the data that we've looked at. Has actually done 136,538 virtual appointments.
Wow.
And as a result of that, there were 1,864,673 miles saved, which is equivalent to going around the world 70 times. Or if you're actually looking at how do you call this, going into the moon 4 times. So
Oh
return
my
trip to
goodness.
the moon 4 times. And
Wow.
the other thing as well is that it actually saved 108,320 hours of patient time saved by doing virtual. And it also saved the trust. If anyone, one of the biggest hospital, one of the key issues that patient usually highlight is trying to find parking. So by doing virtual or participating in a virtual clinic, it actually saves 63,153 car parking spaces.
Oh my
And
goodness. The stats are absolutely fantastic. And it's great, isn't it,
yeah,
now that you've got those stats. So when you're talking to people about the changes you want to bring in, you've got the evidence to prove that this makes a massive difference in terms of, the emission side.
yeah, definitely. And also when we are looking at the carbon emissions, the savings, we're looking at the reduction of 343.7 tons of CO2, which would have taken 180.8 hectares of forest to actually a year to capture.
That's absolutely extraordinary. I can tell you're very proud of those figures, and as you should be, they're really inspirational. Ollie, just going back to electric, Richard's written onto our live Q&A function and says, how have the back-end functions of EV charging been covered by the trust? Third-party control feels too out of our control, but the admin involved with the back-end elements feels like it could be a time-consuming role.
Yeah, this is something we've put a lot of kind of thought into as well, and it's this balance between sort of access to information and sort of control of the charging. And I think day to day we don't necessarily want to, as a trust, we don't want to be sort of operating and controlling the chargers as such. We want them to just kind of work. So that really onus we're going to put on the supplier to make sure that the chargers are working and doing their thing. But there will be sort of like a back office portal that you can log on to, and you can kind of get live status update of all the chargers, whether they're occupied or not, and how much charging they've done, all the information you could possibly want around, I guess, the management of your charging system. But I have to say, I agree with Sue's point earlier that electric vehicles are definitely not a silver bullet, and we need sort of active travel and sort of public travel combined with this. And when you do look at the carbon figures, you soon realize that actually electric vehicles on their own are not enough. They don't do enough heavy lifting to get us to our targets.
We obviously have to look at the whole picture, whether that be cycling, scooters, walking, electric vehicles. But let's throw hydrogen into the mix, Ollie, as well. There's a lot of talk about hydrogen, isn't that? Whether that be hydrogen trains, hydrogen buses, potentially longer term hydrogen fueled HGVs. Is that something that's across your radar at the moment?
Well, I'm glad you mentioned hydrogen because I have a sort of personal feeling about this as well as sort of a practical one. From what I've seen in my sense of where things are going with hydrogen, I see two uses for hydrogen really, and that is sort of large scale commercial shipping, so sort of shipping containers across the ocean where you need sort of a reliable energy source to shift a large amount of weight. And the other one being long distance flights to Australia, for example. Anything else sort of in between can really be covered by electric and batteries. So even short haul flights to places like Paris or even Scotland can be covered by electric flights, although not commercially yet, but it's coming. Even sort of anything roadworthy from lorries all the way down to sort of small vans will be able to be covered by electric and batteries. So my answer to that is I don't see hydrogen playing any kind of role really in the function of sort of NHS transportation.
I could have done with you. We did a whole half-hour panel on hydrogen and not so long ago. And hydrogen isn't my forte, but I did fly in 100% electric small aircraft the other day, which was incredible, in Britain, which was amazing. It only had 4 buttons. Even somebody like me could fly that, I think. And it was so quiet and no emissions. It doesn't go very far. You can only go about 40 minutes in it. But I tell you what, future, don't we, of electric and everything, and it is here already. Stu, talk to us about the issues with trying to monitor the impact of any actions on transport to our carbon footprint?
Because I think it's more the difficulty because as all of us as acute providers were asked to write our green plans, as a trust, I kind of turned around to our colleagues in facilities and estates and said, okay, what's our baseline so that we can work out what we're doing? And then we talked to some other trusts elsewhere, and there didn't seem to be a consistent tool manner by which we were going to be measuring our baseline carbon footprint. And some trusts had been ahead of the game and had done it a few years ago, but it cost them quite a bit of money with some specialist expertise coming in from consultancy firms. And we didn't have that kind of money. So when we were looking around, I must admit, found it quite frustrating because we didn't want to do something that was inequitable or a different tool that other trusts were doing. So we're very grateful now because we do not have our baseline at the moment. That's part of our green plan first sort of 6 months. I'm going to say first quarter, but we're nearly at the end of that now. So we are now waiting, very grateful that NHS England are publishing, so we understand, a common tool by which we can all measure our carbon baseline. And at least we'll be all using I call it a sausage machine, so that what we're putting into the sausage machine is a consistent set of metrics, so that it will process it in a similar way, so that hopefully we can therefore get our baseline. And what we want from that tool is to point out where our big heavy lifters are, so that we know where we need to tackle to get more bang for the buck. Because at the moment, certainly in secondary care and I know elsewhere in the whole system, everybody is so stressed out with the level of work activity going on, and therefore where does the green agenda stay? So to simplify a common way of measuring is going to be really valuable to us instead of us all doing it in a different way.
Is that something that's going to be valuable to you, Kirsty, as well?
Yeah, definitely. I mean, we got to the point where we, because we were using the Sustainable Development Unit tool, which had some issues with it. So we ended up trying to come up with our own carbon emissions calculator, because we too, we needed to establish what our baseline was for a lot of these targets. So we sort of went ahead and tried to do it, but a lot of it is just based on formulas, from to sort of calculate the average journey. So it's not really giving us a true picture. So we've done that for our patients and we've done that for our staff as well. But again, like I said earlier, we've got staff coming from both Devon and Cornwall. Some people could be traveling in substantial distances compared to, just a couple of miles or whatever. So it's really difficult to establish. At the beginning of May, we rolled out a staff travel survey to try to get staff to let us know, how they're getting to work, what kind of vehicle that they're using, etc. But even that's difficult because people don't have time and quite it's quite difficult to communicate out to staff these days. So trying to get a good response rate is really tricky. So we're just trying to do the best with the information that we've got, and hopefully this tool will give us some help with trying to establish the way forward. But the other tool that's been quite good actually is the Greener NHS fleet data collection, because that's meant that we've started pulling out data that we know all other trusts are doing as well. So gives us a bit of a benchmark going forward. So, and especially this year with them including the grey fleet, that was quite handy for us to get a hold of. So yeah.
Oh, I can imagine. Janet, you talked at the beginning about knowing your carbon footprint. I think you said 389. Give me the figure again. Your carbon footprint was?
Yes, that's right. 389 tons for travel and transport.
So what initiatives then will that inspire? I mean, I know you've already started.
One of the things that the trust actually, maybe I would say it as an advantage, because we were one of the 10 NHS trusts that was a pilot for the carbon management reduction. That was back in 2010. So that was the CMP. So from then on, we actually did establish several travel initiatives, particularly for staff. And we did an extensive survey, and that was actually updated every year. And I think we're lucky in a sense that we have quite a strong collaborative working relationship with Travel for West Midlands and also our local authority and Wolverhampton Council, and we've worked together very closely in terms of basically implementing like corporate discounted travel cards, cycle training, access to free cycle parking, etc. And the latest one actually is that Wolverhampton West Midlands has actually introduced like their own version of Boris Bike, and by that close working relationship, I've actually managed to influence that they put a station right in front of the hospital. So,
Oh,
which
fantastic.
means, yeah, which means staff or patient, anyone can access it and actually return it or pick it up right in front of the hospital.
Wow.
And by working through the transport as well, the FWM and the like National Express, those kinds of things, we do provide like discounted travel card as well for a patient, but we are going to embark on a pilot to actually put QR code on the hospital letter that will give
Ah,
them like a discount as well for
yeah.
patient. It's always the patient and the staff that's quite difficult to, and then we will then be able to actually capture how many has used the QR code and where they come from and what type of tickets. So that would give us, but it's going to be a pilot one. But
Yeah.
what I'm trying to say that it is actually quite essential to work with your partners, the authority, local authority, and also the transport authority within the region. And we in the ICS, the Black Country ICS, we actually have a travel and transport team, a work stream that looks at travel and transport all across the Black Country area. And we are then collaborating in ensuring that any initiatives from other trusts or other companies that's actually good is shared with the group and then also implemented. So that's the, I think the whole thing of the transport and travel can't be done by just individual trust. You need to have partners within the local authority and the transport network, because we can't do it alone.
No, we
That's
definitely can't. And I know it's something that Sue's passionate about as well, reading your notes, Sue, before we started the conference. I know that you believe collaborative working is really important, isn't it? Just explain to us, how it helps you and why it's so key when we're trying to make, these differences and changes.
Yeah, completely agree, because an acute hospital on their own can't have that much impact on the wider circumstances around us, particularly when you're talking transport. And there's things that the trust here has successfully done is negotiating with the local bus companies so that we can get some free staff travel, particularly. And I like the idea of having a station right near the hospital. We haven't got that far, but we've got free buses for the staff. You only need to kind of wave your name badge. And I used this last year. So from Woking, which is 5-6 miles from the trust, we are in the middle of nowhere, except for cars. It's very difficult to get to us. So staff can get there and they get free bus, which encourages more to take the public transport. And I think it's whatever is the means, whether it's the building of the roads, the building of the cycling paths, the access to public transport in different novel ways. We've been talking about carer passports. Can those kind of things that are dealing with other issues in your community, perhaps a carer's passport could also then be negotiated as part of free travel and all sorts of things with our local public transport, alongside them trying to move their vehicles to be more electric. We're thinking about, can we put major electric charging points here on our site that encourages more bus routes to come via us for a top up between two towns, and can that then get more routes to take us into the local networks? And then we can talk with them about timetabling as well. So you've got to build those relationships closely with your county and local borough councils to do these things. Those relationships, trusting relationships. We're lucky down here because Surrey County Council 2 years ago now, maybe, declared a climate emergency. So it's using those kinds of things and saying, come on, if we're all on this agenda, let's do something practical and let's just not just languish about this.
Well, we're going to do something practical now. I've only got a minute left, but I've got 2 questions, probably one that Ollie might be able to take from Dan. Dan says, our main challenge is understanding staff and patient travel. Are there tried and tested methods that can capture this easily? Is that something you can shed any insight on, Dan? If not, I'm sure Kirsty can.
We are going to be doing some research on this to kind of work out the best methods. We haven't quite measured it yet. So I'll probably look to the others for a bit of inspiration on the travel surveys they've been doing.
Kirsty, what about you? Tried and tested measures that can capture this information easily about staff and patient travel?
Yeah, I think it's really tricky because all we've been using are like formulas just for an average patient journey, which I think is like a 6 or 8 mile round trip. So and that's not reflective at all of the region that we're in, particularly. So that's a really tricky thing to do, and I'm not quite sure how we're going to establish that going forward. But it's certainly something that's on the radar that we're going to be looking at.
And just finally and briefly, Janet, because I'm strictly speaking, I'm out of time, but I just wanted to squeeze in this thought from Ian. Ian says, what proportion of virtual appointments are with the over 60s? Or with my 60th birthday this year, perhaps this should now read over 70s. Are there particular challenges with the Silver Surfer generation?
There is, definitely there is, and that's one of the triage when we are actually when the clinical staff look at any referral, they actually look at whether this person is actually appropriate for a virtual clinic or actually it needs to be face to face. And there are certain items, certain categories that they need to look at. To look at whether they, what is appropriate for them. So there are certainly challenges, and at the same time, not all over 60s are actually that's internet, savvy as well. So that's one of the things. So when it comes to virtual clinics, you need to have the right protocol in place to make sure, because the bottom line of it is actually quality of care and the best patient experience you could provide. And that's the bottom line. It's not just about, okay, let's just get someone in here for a virtual clinic because it would be appropriate, but it's about looking at all those aspects and making sure that, like what I said, bottom line, quality of care and the best patient experience.
Absolutely. And sometimes for people who perhaps are retired, it's, the seeing somebody face to face is more important. But for somebody who's perhaps in a very busy day-to-day job, they'll embrace the speed and of a virtual clinic, as well as it's not just the tech, is it, as well? It's a bigger picture. We are massively out of time, which I knew we would be because you've all been such great talkers. So massive thank you to Kirsty, to Sue, to Ollie and Janet. And we hope we'll see you at another of these events to find out, what progress you've made. So thank you very much indeed. Next up, we're going to hear from James Bate, Senior Project Manager at South East Greener NHS Programme at NHS England. James will be talking about tackling air pollution in the NHS, giving some examples of best practice and highlighting the health impacts of bad air quality. So over to you, James.
Thank you for the introduction, Helen. And hey, everyone. As stated, my name is James. Today, talking about air pollution. I'm also the travel and transport lead for the South East Greener NHS team. And I'll ping over my email address later on if you've got any questions. So just want to go on to the next slide and we'll go on to the agenda. I'm going to start off with looking at the health impacts and then into the sources, the causes of air pollution, and lightly touching on the science of that. Then going to look into why it's so important for the NHS to act on air pollution by outlining the case of Deborah. And then we'll finalise looking at what the NHS can do by looking at examples of best practice and tools and resources as well that can be used to tackle air pollution. So just next slide, please. So yeah, just a brief bit about me, my role and what we're doing as a regional team. So we're responsible for 6 ICSs across the Southeast, and travel and transport is my priority area. These are the 3 metrics that we have to deliver on, looking at sort of electrical vehicle infrastructure requirements, and also cycle to work schemes and improvements to active travel. We're also leading a number of regional projects looking at travel and transport and working in collaboration with the Energy Saving Trust and Mobility Ways as well. Next slide, please. So air pollution is the biggest environmental risk to health, as stated by the World Health Organization. There's no safe limit to air pollution, and by driving, we are directly contributing to negative health outcomes. Air pollutants have a direct link to respiratory and cardiovascular diseases, as well as a number of other health conditions such as dementia. So it makes complete sense. Can we go back? Sorry. It makes complete sense for the NHS to tackle air pollution, primarily because it contributes to up to 36,000 deaths, and bad air quality can cost up to 5.3 billion by 2035 if we don't act. It also exacerbates health inequalities, as those who contribute to the problem suffer the most. Those who contribute to the problem the most suffer the least, that's the one, especially in deprived urban areas. So quite simply, if we reduce our emissions, then we can reduce our admissions into practices and hospitals. We need to take a preventative approach and stop air pollution at source. So it's not only good for patient health, but it's good for the planet too. Next slide, please. So Imperial College conducted some research and actually found links between air pollution and the vulnerability to COVID-19. The main findings were that long exposure to air pollution actually increased hospitalization, increases susceptibility to worse outcomes, and even increased the likelihood of catching the disease. Again, just emphasizing the importance and relation between air pollution to the NHS. Next slide, please. So I'm no expert in this field, by no means. And if you need more information on the health science of air pollution, I highly recommend checking out Jonathan Grigg and Stephen Hallgate, both world-leading professors in respiratory illnesses with a focus on air pollution. And Stephen Hallgate particularly championed the Efficacy Deborah campaign. Now, I've got a couple of videos, training videos of theirs, which I can post. So I'm going to work with NHE and send a follow-up with all of the links and resources mentioned in this presentation. Next slide, please. So I've talked about the health impacts, but what about the causes? Where does air pollution come from, and what's it made of? Now, air pollution is made up of 2 main sources, particulate matter, also known as PM2.5 and PM10, and pollutant gases. As you can see on the right, PM10 and 2.5 is dependent on how big they are, and they're tiny, literally impossible. This is why air pollution is quite important to tackle, because it's invisible. It's the invisible killer. Obviously, on high air pollution days, you can see the smog over London, and obviously during lockdown, we could notice clean air, but theoretically, it's invisible. Now, the main source of particulate matter is through combustion, such as solid fuel burning, which has big health impacts. And this is one of the real problems of pro-environmental behaviour change domestically. Say you want to swap your gas boiler because you want to save on energy bills and be more sustainable, but in fact, you actually install a log fire, which contributes to bad air quality. In my opinion, the best option would be to get an electric boiler and switch to renewable tariff. That's a conversation for another day. Now, the main source of nitrous oxides is through driving. And I remember reading an article that said that you're 8 times more likely to suffer from the effects of air pollution if you're in the car as opposed to walking in areas of green space. So again, sort of highlighting the importance of active travel as opposed to driving. Next slide, please. So this is just some information from Public Health England, again, extending my point. You can see at the bottom, road transport is a big cause of nitrous oxides. And then in the right-hand side, combustion is a big contributing factor to particulate matter. Don't ask me what the other chemical elements are, because I was never good at chemistry, so I don't want to touch upon that. Next slide, please. And then this is an image used by idling action, and idling your engine is so bad for air pollution. Just look at that. Idling in a minute causes that much pollution, and if you're walking to the bookshop on the right hand side, you're breathing in those fumes. Loads of local authorities have been quite proactive around anti-idling, and have developed idling policies and idling campaigns, and I think Camden Council actually tried to regulate idling and actually fining people who are regular offenders. Next slide, please. So I'm going to talk a little bit about the story of Ella Deborah. And Ella lived on the South Circular and died from a sudden asthma attack. Thanks to Stephen Horgate and her mother Rosamond, the coroner actually put air pollution as a cause of death on the death certificate, which was the first time it ever happened in the UK. More recently, the Ella's Law is actually starting out in Parliament, and the bill looks into establishing a right to clean air and a commission that's going to oversee governmental action and progress. The coroner's report also stressed the importance of health professionals and how we need to talk to patients about the dangers of air pollution, especially those who suffer from respiratory and cardiovascular disease. However, through its own operations, the NHS must act through travel, energy and procurement. Next slide, please. So this is just an image taken from the Cleaner Hospital Framework of a hospital not doing anything. Look, we've got lots of cars. We've got dust from construction, loads of parking, idling, very cloudy sky. This is what we want to try and avoid. And if we go to the next slide, this is a vision of what we could actually get to. So we've got cycle storage, we've got a last mile delivery on a cargo bike, we've got green space, local transport links, active travel, we've got consolidated deliveries as well. And what's the result? We've got nice blue skies. Obviously, if it was in Manchester, there'd be grey skies, but we can see that they're taking real action to improve air quality. Next slide, please. So here's just sort of three main priority areas of how we can improve air quality within a trust. We've got active travel, so improved storage facilities and shower facilities for people cycling and walking to the hospital. We've got cycle to work schemes and doctor bike sessions as well to encourage that behaviour change. Within procurement, consolidated deliveries to reduce unnecessary emissions, anti-idling sessions for suppliers, and obviously cargo bikes too. And then lastly, comms and engagement is massively important in terms of behaviour change. We need to train clinicians on how to have effective conversations. We need to put signage to inform patients about the dangers of air pollution. And this can happen both in secondary care and in primary care as well. And it's also important to get involved in campaigns such as Clean Air Day, which is on the 16th of June. Next slide, please. So this is some examples of best practice. Barts Health have really led, and sorry about the London and South East focus. I've worked with all these trusts, so I'm a little bit biased. Barts Health have got an air quality steering committee, a dashboard that reports back directly into the board. Guides and St Thomas and the infamous riverboat service. Oxford Health are collaborating with local partners to deliver a sustainable hub. And Great Ormond Street developed the Clean Air Hospital Framework and are embedding air quality measures throughout their operations. Next slide, please. So I also want to touch upon North East and North Cumbria. They've helped develop a ICS Clean Air Framework, and they are looking at collaborating with local authorities and working with local partners on how to improve air quality at scale. And that ICS Clean Air Framework will be available later in the year. Next slide, please. So lastly, I just wanted to end on some tools and resources that we can use. We've got some messaging on the left-hand side, and then on the right, we've got various initiatives such as AirTest, which can advise you on air pollution days, and Breathe London, which is actually taking air quality monitoring across the city, and various other organisations such as the Clean Air Champions Network and the Clean Air Day campaign. So that's all from me. Had to try and fit it in 11 minutes, prepared for 15. So try to get it all in there. Again, sort of thanks for your time. And I think we're all aware that air pollution is a key bridge between health inequalities, the climate change agenda, public health, prevention, and various different aspects, and allows for conversations with local authorities too. I'm going to put my email into the chat. Please reach out to me if you've got any questions, and I'll happily share any of the resources which I mentioned today. I'm going to pass you over back to Helen. So again, thanks for your time, and I hope you have a great rest of the day. Thank you.
Well, thank you, James, for an insightful session on air quality and for making time to join us. And I'm sorry it was 11 minutes rather than 15, but you did very well. Time for our final short break. This is your last chance to get the most out of the event by utilising all of the functionalities on the NHE365 platform, whether you want to make a connection, share thoughts in the live chat, or get talking with our exhibitors. When we return, we'll hear from Benjamin Tongue, Digital Net Zero Lead at NHS England. So we'll just take a quick 5-minute break. Perfect.